Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about TMD patients, temporomandibular dysfunction patients who have issues with their TMJ, temporal mandibular joint, and what to do if they want orthodontics, how I handle it in my practice. Remember, I'm not an expert on this. So there are dentists who really consider themselves experts. I don't believe it's especially at this point. I usually have always referred to oral surgeons, although there's some general dentists who claim that they specialize in this, but I don't think it's an actual specialty, as last I heard. But in any case, I'm just going to tell you what I know and how I handle it. So I'm assuming if you're listening to this video, that you probably are some type of dentist who's thinking about doing ortho, or even a patient who's thinking about getting ortho, and you want to know if it's okay for you to have ortho if you're having issues with your TMJ, aka you have TMD. So first of all, let's talk about what a TMJ is. TMJ is a hinge joint that connects your jawbone to the bones of your skull, right? It lets you move your jaw up and down and side to side so you can talk and chew and things like that. So what causes issues with the joint? Well, first of all, we all are getting older, right? And like any joint, a knee, a hip, a shoulder, issues can happen, right? It could be due to lots of different things. So it could be due to an injury or trauma, or just clenching or grinding your teeth, stress, arthritis. The most common, to be really honest, that I've seen is either the injury, or trauma, or somebody who's stressed, grinding, clenching. Okay. Stress, grinding, clenching, easier to handle. Trauma, different story. But the more you have this, lower level, more acute stress, grinding, clenching, the more it can turn into issues like trauma later, right? So I need to kind of dig into it a little bit more. So the first thing when someone mentions that they think they have issues with their TMJ and they have TMD is I like to know more about it. So I ask a lot of questions. Can you tell me about the symptoms? If they're just having some pain, tenderness in their face, maybe down their neck, shoulder, around their ear. If it's happening more when they're speaking, talking, laughing, opening wide, eating chewy things, stressed, and it goes away, that's probably fine. I mean, obviously we're going to try to treat it and minimize that, but it's probably not a huge deal. It's just a matter of avoiding certain types of foods and situations, changing your behavior, and it should, go away for the most part. I mean, everyone gets that. I even get that. So sometimes it's a little worse. I always like to know when it happens, how it happens, if it goes away, the level of discomfort. This is all really important stuff to ask. I mean, obviously, if they're saying that it's happening all the time and it's a 9 out of 10, well, am I going to do ortho on them? Absolutely not. I'm probably going to refer them to a oral surgeon to have further testing. But if they're saying that, oh, it happens more when I eat chewing gum, eat bagels, or after I'm stressed and it's a 2 out of 10, well then, we'll try changing behavior and diet and see if it gets better, and then we can do ortho. But of course, if they're super stressed about it, they always go to OS, before I would even consider doing ortho. And if it's something severe, I don't do ortho at all. So that's a no. So what else? Other things that I consider more troublesome is when the jaw gets stuck, either locked open or locked closed, and they can't easily reduce it. That's a problem. That gets a referral to OS for sure. That's a completely different story than just the occasional clicking, popping, a little bit discomfort is relatively normal. Everyone gets that as they get older. Even kids can have that. If they're having severe toothaches, headaches, neck aches, hearing problems, pain in the shoulder, ringing in the ears, that's more of a problem, I would say. The OS will usually do tests like an MRI, maybe a CT, to look at the joint. Sometimes they do surgery. That's not my thing, but the main thing is I like to have the patient avoid extreme jaw movements. So yawning, chewing, no chewing ice, no chewing gum, eating chewy foods. A lot of times when they're just, trying to learn more about it, I'll ask them for a diet log, a diet journal for 2 weeks, every single thing that goes in their mouth, Doesn't matter if it's chewing gum, a candy, a mint, it needs to go in the journal. And then I'll look at it and I'll find things that maybe can cause it, right? But also the other things that can cause it could be resting your chin on your hand. If you're resting, if you're in class or you're in school or at work, holding your phone between your shoulder and your ear can cause issues. Good posture can cause issues. For me, I can tell you that I do have, pretty severe TMD issues in my TMJ. I'm using this correctly so you can get used to saying it correctly. For me, what I do for treatment is, yeah, I stay away from gum, really chewy stuff, things like that. But also, to be honest, managing stress. And I use masseter Botox. It is a godsend. It is life changing. It's not cheap, and dentists can administer it in most states and countries, especially therapeutic for intraoral reasons. Um, I haven't yet found a dentist to do it, so I guess I could do it to myself. I know how to do it, but I mean, the prices at the day spas are pretty good. Medical, day spas where you get Botox anyway. So, and when you buy more units, it's usually cheaper. It's not cheap. I do it twice a year, as part of, regular maintenance. And I think I end up getting about 30, 40 units per side. So it ends up being easily about $800, or if not 1,000 every, I hope my husband's not listening to this, every twice a year. So it's not cheap. And unfortunately at the moment, I know that Botox can sometimes, when done by an oral surgeon or an MD, sometimes for headaches, if you have chronic migraines, and this is all interrelated, it can be billed, but at the moment for TMD issues, it is not billed, as far as I know. I've tried for medical reasons, although to me it is completely medical, the reason why I do it. Now in lighter, you're gonna have to titrate it. So initially they might put in 20 units per side, and then you'll come back a couple weeks later and they might do more. So you want to get to the point where you wake up in the morning, for me, and you don't feel severe discomfort. For me, it's in the morning. I feel it. It radiates all the way down my neck, my jaw, everything like that. So, but it is really life-changing, I can tell you. So that has kind of been my go-to relief thing for patients who are interested in getting ortho. Is we do the diet journal. We consider doing the masseter Botox first to see if it goes away. Now, if it goes away, great, let's do ortho. You're good to go. It's just stress related, parafunction related, clenching related. We'll just relieve that, and just, that's something they're going to have to do every 6 months to keep the pain under control. By the way, in bigger doses, you can actually get, if you have strong masseters, and the way my technician checks it is she'll have you bite down super hard, and then she'll see how thick your masseter is and how much it bulges out, That's how she tests it. But in stronger doses, it can actually cause a lot of facial slimming, really much more contoured jawline. So just things to think about. It's really big in Korea. That's how I first heard about it, like about 10 years ago. Anyways, okay. Other things you can do: physical therapy, massage, biofeedback, stress reduction. Medications could be NSAIDs, or even if it's an acute thing, you can try something like muscle relaxer. It has to be prescribed, of course. It's a scheduled medication, but it does really help as well. But nobody's going to give you muscle relaxers for every day, right? So lastly, if you don't want to have ortho, or even afterwards, you consider like a night guard or a splint. There's anterior repositioning splints. Not really my thing. I don't know much about it. I do have a night guard, and it doesn't help at all, because basically if you're a clencher, you're just going to clench on the night guard. So now you're clenching more because you have something in there. So anyways, if the question is, will orthodontics make my TMJ feel better, make my TMD go away? Not necessarily. Can't predict that. Don't know. No promises. Obviously, if you have a really weird, wonky occlusion, it might help, but it might not. And there are usually, in informed consents, there is a section about this. However, if this is an issue, I feel like you need to be a little more careful about treating these patients and picking these patients. So that's why I like the idea of doing the diet journal and the masseter Botox at their own expense, of course. First, seeing if it relieves, and if so, then I feel comfortable doing the ortho. If it's getting worse, I send them to OS to have the evaluation. I want their written permission to do orthodontics. I want the oral surgeon to say it's okay for us to treat, and the patient doesn't need any additional surgery or treatment of any type, or imaging or anything like that. So always get the release from the oral surgeon if you're not able to manage it with the patient through diet or pain relief. So that's pretty much what I recommend. Of course, like I said, if the bite is way off, hopefully having ortho will help things out. No promising. Sometimes it's just a matter of getting better dental work, balancing occlusal equilibration. Like I said, splints might be an option. But you just don't want to be making this patient, if the patient had trauma, you don't want to be making things worse. And often by putting braces. And when you're in ortho, there's a lot of temporary bites that happen. It does get a little unstable here and there as we're moving from one position to the next, and that can actually make things worse on a severe TMD patient, so temporarily. So that's why I don't take these patients unless I have that release. Either I've cured them through one of the ways, or I send to OS for the written release. All right, thanks so much.